was a little bit of a misnomer. I'm going to talk more generally about the state of digital health, and then Gil is going to introduce some other, more of the digital ophthalmology companies. But I am so excited to be here. So as Gil mentioned, I was here 3 years ago, and as you'll see later in a slide, at that time we thought we were at the peak of digital health. We could not believe how fast the industry was growing. And as you'll see later, it's just continued exponentially since then, 3 years ago, so it's very exciting. My background is I was actually in one of the first digital health companies back in 1999, and somebody called me a grandmother the other day, and like a grandmother of digital health, and I wasn't sure if I should be offended by that or complimented that I was there at the beginning. But in any case, myself and then Andrew Burns, who's going to be speaking later, helped build one of the first mobile digital companies called Hippocrates, which some of you may have used getting information on your phone. So digital health, I like to call it the perfect storm, right? So there are a lot of different factors happening in the industry right now that is driving tremendous growth, not only in the number of people in digital health, but the amount of money going into it. So, first, you guys are all aware of this. We're nearing $3 trillion in terms of healthcare spend, and people are looking for how can technology help reduce costs in the industry and make us more efficient. The general population is getting unhealthier. If you have extra time and you want to be scared, go to the CDC's website and their obesity map and click through it, and it shows over the last 20 years how obese our country's become. We're up to 35% of adults are obese. And luckily, if you're in Colorado, you're the least obese state. If you're in Arkansas, most obese state. The third one really is what I've been keeping an eye out on, because I think this is transforming the industry. The kind of rise of retail in healthcare and the fact that consumers are now paying more out of pocket for their own healthcare costs and actually becoming consumers in healthcare. We have not had consumers in healthcare for the most part in the past. And so if you're spending more out of pocket, you're thinking about, I want more access to information, I want price transparency, I want to see my options, etc. And so that's really driving a lot of the companies in this space. And then lastly, just policy. So I just put this one up there as an example. There's a lot of companies coming into the space that are in the health improvement and health improvement incentive space. And part of that is driven by one of the provisions in the ACA, which said now 30% of a medical premium dollar can go towards health improvement programs or incentives for those programs. And so that changes the dynamics in terms of where some of those industry leaders are putting money. And then obviously you have the rise of technology and social, and all of that is leading to more companies and more dollars. So digital health encompasses a lot, right? There are many different areas. You have mobile diagnostics, big data, clinical decision support, etc. So because it's a big category, you expect to see a lot of companies, but I did not expect to see this number. So when I did the research, there are now 7,600 digital health companies across the world. So when I spoke 3 years ago, there were 2,100. So we've seen a significant increase there. Just to give you a sense of funding, so out of the whole healthcare sector, digital health funding is one of the fastest growing areas. And so back when I spoke in 2012, I mean, we were astounded. We went from 1.2 billion to 2.5 billion, and we couldn't believe that. The number of companies went to 468. Last year, almost $7 billion in investment went into the digital health space with 551 companies. Now, some people will argue that's good. Some people will argue that's bad. I do think maybe some companies in that space got funded that were not companies and more products, and we'll kind of see the fallout for that in the future for the industry. But it's undeniable that funding is going into the space and there are more companies. These were projections for just before the end of Q2 from Startup Health, which is a great resource if you're interested in the digital health space. Most people are projecting funding to come in a little bit behind what 2014 was, and maybe the number of companies to come in a little bit behind that too. So where's the money going? This is from a Rock Health report, another great organization if you want to look up information. So the first half of 2015, these were the 6 big areas. So wearables and biosensing, Gil asked about wearing a Fitbit. It is actually moved into the mainstream and beyond kind of the Silicon Valley quantify itself in terms of the number of people wearing wearable devices and tracking their activity. Analytics and big data, another hot area. Healthcare consumer engagement, that goes along to the fact that as the industry's changed and become more consumer focused, everybody's trying to figure out, how do I engage the consumer? So if you're a health plan executive in the past, you might have thought as the consumer more of a claim, right? Now you have to think about the consumer as someone you want to develop a relationship with versus someone you're trying to keep off of the phone. Telemedicine is another big area. I think that industry had languished for a while, and we're seeing several companies now break out. The wellness space becoming big as well, and then continued investment in the EMR and clinical workflow space. And then I just listed a couple companies there that you'll see later that fit into that workflow space as well as kind of the mobile diagnostic space. So one thing I wanted to point out, and this has been a big driver in terms of the number of companies in the digital health space, is the rise of this idea of the healthcare accelerator. So 5 years ago, Rock Health was the first accelerator program in healthcare, and now there are 85 healthcare accelerators in the United States, over 30 in California alone, which I thought I knew a lot about the accelerators, and I had no idea there were over 30 in California. So as I mentioned, there's 85 different companies. You can see they're broken out by enterprise. Some companies are developing their own incubators and accelerators to fuel innovation inside. Athena Health, for example, is trying to develop their own community and ecosystem for products that can plug into their platform. You also have Dream It, for example, which is focusing in a specific geography, so trying to get digital health innovation in Philadelphia. And then this was interesting, that you're also now starting to see focus by condition areas. So this is an accelerator in Germany that is just focused on kind of the prevention and treatment of eye diseases and blindness. And so here companies can apply to be in the program. It's a 12-week program. You get money, you get mentoring, you get access to companies, and that's how all of the accelerators work. And it's just interesting that now we're moving out into clinical areas. So that's it, real quick. I just wanted to give you a high-level overview of what's going on in digital health, and Gil is going to come back up and introduce some of the most interesting ophthalmology companies.